Hello, this is Let's Update Language Academy with yet another role play card presentation, and here for a variety we are actually presenting a doctor's role play card. But I would say there is no much difference between the doctor's role play card or nurse's card. For the examination you will get two different role play cards, but the setting and the structure is always same. And I used to give it to nurses cards to doctors and doctors cards to nurses in fact.
Yeah, right.
And why I'm very happy this time is because in this examination there was a similar card for the nurses. It was actually once asked for the doctor's examination. So I think my point was right. You can mix the cards and give it to each candidate. No problem in that. Okay.
Yes.
So we'll experiment with that today.
Yeah.
Okay.
Sure.
So you can just think whether is there any difference with the nurse's card or doctor's card. The question is to you. After the presentation, you can comment in our comment box. Okay. And for this card, as I always mention, you can check it in our Telegram group. You'll get it there. So shall we start?
Yeah, sure.
Okay, so I'll be playing the role of the doctor, and she'll be playing the role of the patient or the interlocutor. So shall we start, Sandy?
Sure.
Usually we have 3 minutes as a preparation time, but we are right away starting. Okay. So I would also explain the scenario once again. It's a 40-year-old patient who has a large painful lump on the back of his or her neck, which was diagnosed as carbuncle, and I have just examined the carbuncle, and I'm giving my examination results or the analysis. Okay. Alright, so during the role play, how may I address you?
You can call me Shamili.
Thank you. Alright. Thank you, Shamli. I have examined your carbuncle and I could find that it has not reduced its size. How are you feeling right now?
I'm feeling quite tired.
Okay, thank you. I'm so sorry to hear that. Thank you for the information.
Mm-hmm.
Regarding the symptoms, I would like to collect some details so that I'll get a better idea about your condition.
Yeah.
So can I ask some questions?
Yeah, sure.
Alright, so tell me about the symptoms. Do you feel any high temperature or experiencing any fatigue or noticed any nausea feeling?
Well, I don't think that I had a high temperature or I don't have any kind of nausea or anything. But I told you, I'm feeling quite tired.
Yes, you have mentioned it before. Definitely, don't worry. We'll look into that. Okay. Alright. So, from the examination and also from your explanation, as you said you are tired, I think the antibiotic is not affecting appropriately. The carbuncle area is quite swollen, and the pus is there around, and it hasn't reduced in size, as I mentioned. So, what I think is we'll continue with the current medication for another 7 days. So, we'll take this antibiotic for another 7 days and we'll see. How does that sound to you?
Oh, well, sister, I don't understand why I need to continue this antibiotic, because you told me that it's not working properly. So why necessary to continue this antibiotic?
Oh, that's a very brilliant question from your side, because you're very concerned about your condition. But I can tell you that this is highly virulent. It's quite in a severe situation. So it might need a longer course of antibiotics, and definitely it likely to affect more if you continue for another 7 days. And if it doesn't, we'll take an appointment with the doctor and we'll see further. Okay? And as a next step, what we'll be doing is we'll give you the antibiotics and also the analgesia, and we'll schedule you for a surgical drainage. Okay?
Yeah.
And do you know about this surgical drainage?
Oh, well, I don't have any idea regarding about that. I got the point, like why I continue this antibiotic, but I want to talk to you something regarding this. In just case of getting rid of this pus inside, can I birth it myself?
All right, that's a question that I definitely have to resolve. Give an appropriate answer to that.
Yeah.
And before that, can I ask you? Can I explain you regarding the surgical drainage procedure? After that, I'll come to that question, which is really important. Okay.
Okay.
So this surgical drainage is like we'll insert a tube and we'll drain the pus and the clean area and also we dress it. Because in your part, we need to make you aware what is actually the procedure is. That's why I explained. I hope it's clear.
Oh yeah, that's clear.
All right, and in case if you feel to burst the carbuncle, I would afraid no. because it is done in a very sterile condition.
Okay.
So I highly recommend you to know to do that, because the self-treating would lead to further spread of the infection over the bloodstream, and it may lead to more complication or serious situation. And it can cause scarring also. I definitely think you don't want any scarring on your body, right?
Yeah, right.
Yes, so better don't do that. Okay. And is it clear to you?
Yeah, that's clear.
Alright, so can I ask one more question?
Yeah, sure.
Yeah, I have actually advised you regarding the hygienic measures that you need to keep, like antibacterial soap, washing clothes, and keeping it in a high temperature to make it infection free.
Yeah.
I hope you are following that.
Yes, I have been following the hygienic advice exactly you told before.
I'm so happy to hear that. In fact, I would stress it again because it's very important, and because it will reduce the risk of infection spreading to this, and it will keep the carbuncle safe. I mean, it won't lead to any further infection. Okay, and we'll see whether this antibiotics are working to you, and it will resolve soon. Okay.
Okay.
Alright, so can I take an appointment or fix an appointment so that we can start the surgical drainage on the day?
Yeah, sure.
Okay, thank you so much. I hope I have cleared the doubts which you had.
Yeah, sure.
Alright, so I hope we'll be seeing on the next appointment for the drainage.
Definitely.
Okay, thank you so much.
Thank you.
Thank you. So that was the presentation of the role play card, and it was a doctor's card, but by the time we start presenting, I became the sister or the nurse and she became the patient. But that is in mind, as I said, whether it is doctor's card or nurse's card, the information that we pass to the patient is all about the disease condition, and we have to make the patient confident about his condition and also the service that we provide.
Yes.
I hope I could give it to you rightly, right?
Yeah, rightly. There is no any differences between the nurse and patient role play card. Almost the points are same.
Yes, so we couldn't find any difference, and this actually changing the role play cards and practicing it would definitely give you more opportunity to practice a lot of cards. Exact like the examination, isn't it? So here what I think is like at the end of the presentation, what I felt when I look back is I was very fast when I say certain things.
No, I don't think like that.
Okay, so kind of me, but what I felt was I was a bit fast. You can slow down the pace when you give information, because it's certainly to a patient, so patient has to get all the information that you give. And I think it was quite a natural way, because I rarely look into the card for collecting the information. I was giving it, she was actually cooperating with me so well, so I could give the information to you very well, I guess. So for this card, as I mentioned, you can check in the Telegram group and keep following us. We'll be coming with more role play cards for your benefit. Thank you so much.
Thank you.